حوالے سے آبادی کے حوالے سے، تو اس میں سبسٹینٹیولی ہم اس چیز کو ڈسکس کر ہی نہیں سکتے، کیونکہ ہمارا تو پہلا پیمانہ جو ہے وہ آبادی ہے. آبادی ہماری زیادہ ہوگی تو ریسورس ایلوکیشن کے اندر ہم کسی انڈیکیٹر میں کسی سیگمنٹ میں فال کریں گے ود ان دا فیڈریشن، ود ان فیڈریٹنگ یونٹس. اسی طرح سے دوسری اہم چیز اپنے کانٹیکس میں، جی بی کے کانٹیکس میں، اور اسپیشلی اگر ہم اس کو کے پی سے بھی سنک کریں تو ہماری جو ایکولوجیکل فرجیلٹی ہے، کلائمیٹ چینج کی جتنی ہم پورا ملک اس وقت کلائمیٹ چینج سے پورا خطہ افیکٹ ہے، لیکن اس کا اگر جو واٹر ٹاور ہے جی بی، کے پی کے بالائی علاقے اور جی بی، تو جس طرح سے کلائمیٹک افیکٹس ہیں یہ تین چیزوں کو پروموٹ کرتا ہے ہمارے خطے کے اندر. ایک تو ریپڈ اربنائزیشن ہو رہی ہے، دیہات سے لوگ شہروں کی طرف آ رہے ہیں. یوتھ بلج، جہاں 65% آبادی بلو 30، میں 61% آف دا پاپولیشن ان جی بی از بلو 35. اسی طرح سے جو لمیٹڈ ریسورس بیس ہے، یہ جو نقطہ ہے بنیادی طور پہ لمیٹڈ ریسورس بیس جی بی کے کانٹیکس میں اگر میں بات کروں تو این ایف سی میں ابھی جانے کی بازگشت میں ہم یہ ساری کہانی آپ کو میں نے سنائی. ابھی تک وی آر ناٹ ان دا فیڈرل ڈویزیبل پول اور ان دا پروونشل ڈویزیبل پول. تو جو گرانٹ میکنگ ہے فرام فیڈرل ٹو گلگت بلتستان، اس کے اندر ہم آبادی کا پیمانہ ہی دیکھتے ہیں. جہاں میرے پاس وزارت خزانہ کا پچھلی حکومت میں قلمدان تھا، تو فیڈریشن کے اندر ہماری جب بھی کسی ریسورس ایلوکیشن اور ریسورس شیئرنگ کے اوپر گفتگو ہوتی تھی تو ہمیں سب سے بڑا تانا جو سننے کو ملتا تھا وہ یہی تھا کہ آپ کی آبادی بڑی محدود ہے، تھوڑی ہے. تو میری گزارش یہ ہوگی کہ دوسرے صوبوں سے مختلف جو یونیکنیس ہے، اس کے باوجود تعلیم، صحت اور دوسرے انفراسٹرکچر ڈیولپمنٹ کے اندر اپنے محدود وسائل کے اندر رہتے ہوئے گلگت بلتستان کی حکومت کی کوشش ہے کہ وسائل کی منصفانہ تقسیم جو ہے وہ ممکن بنائی جا سکے، اور جتنے بھی پاپولیشن انڈیکیٹرز کے حوالے سے جتنے انیشیٹوز ہیں فیڈرل لیول پہ، ابھی یہاں پہ یہ نرسز کی بات ہوئی، ہمارے لیڈی ہیلتھ ورکرز کی، تو لیڈی ہیلتھ ورکرز کا ایک فیڈرل پروجیکٹ ایکسٹینڈڈ ٹو جی بی تھا. وہ پچھلے 1.5 سال سے ریویژن نہ ہونے کی وجہ سے فیڈرل کے کوارٹرز کے اندر سٹک ہے، لیکن سٹل تقریباً کوئی 3,500 کے قریب جو لیڈی ہیلتھ ورکرز ہیں وہ پچھلے 1.5 سال سے گلگت بلتستان میں بغیر تنخواہ کے کام کر رہی ہیں. تو گلگت بلتستان کے صوبائی وسائل کو اگر ہم کوارڈینیٹ کریں، اس طرح کے کانسیکوینشل ایشو، ایک نیشنل ایشو ہے، اس کے اوپر گلگت بلتستان کی جو ریسورس کی پسلی ہے وہ بنیادی طور پہ اس قابل ابھی ہے نہیں کہ ہم اس ایشو کے اوپر یونیلیٹرلی یا پرائرٹی میں خرچ کر سکیں، پرائرٹی میں اس کے اوپر کوئی ایکشنیبل میئر لیا جا سکے. اپارٹ فرام آل دس، گلگت بلتستان کی اسمبلی کے اندر میں چونکہ پاپولیشن کاؤنسل کے ساتھ پچھلے 1.5 سال سے وابستہ رہا، ہم نے اس کو ٹیک اپ کرنے کی کوشش کی. گلگت بلتستان کے ایوان کے اوپر ریزولوشن کی شکل میں ہم لے کے آئے تھے اس کو، اور اس کے اوپر ایکشنیبل پرومسز جو ہیں وہ ممکن بنانے کی حد المقدور کوشش کی جا رہی ہے. تو گزارش آخر میں یہ کہ جب تک ہم فیڈرل فریم ورک مرتب نہ کریں، وسائل کی تقسیم کے اندر بنیادی پیمانہ آبادی کو رکھتے ہوئے ہم جتنے مرضی کانفرنسز کر لیں، جتنے مرضی ہم ایکشنیبل میئرز کی تشہیر کریں، میں ذاتی طور پہ یہ سمجھتا ہوں کہ آبادی میں بے ہنگم اضافہ جاری رہے گا. بہت شکریہ.
جی بہت مہربانی، آپ نے بڑی تفصیل سے بتایا گلگت بلتستان کے بارے میں. وہاں پہ جیسے ہم سب لوگ جانتے ہیں ایک بالکل پاکستان کے لیے معیاری تعلیم کا نقشہ جو ہے وہ ہمارے سامنے ہے. یہ تقریباً ہائیسٹ انرولمنٹ ریٹس گلگت بلتستان میں ہیں، ہائیسٹ ریٹینشن ریٹس بھی گلگت بلتستان میں ہیں. تو ایجوکیشن سیکٹر میں تو بہت بہتری آئی ہے اور بہت تیزی سے پروگریس ہوا ہے. اور ہم نے بار بار آج صبح سنا ہے کہ اگر پاپولیشن اور آبادی کے بڑھتے ہوئے دباؤ کے بارے میں کچھ کرنا ہے، اس کو بہتر مینیج کرنا ہے اور ترقیاتی پروگرامز کو دیکھنا ہے، تو اس میں تعلیم کی انتہائی اہمیت ہے، لڑکیوں کی تعلیم کی خاص طور. تو گلگت بلتستان has laid the groundwork, I think, very much in the education sector. for that. We will come now to Azad Jammu and Kashmir, and then after that to Punjab, because Punjab spoke first, and now you will have an opportunity to speak also at the end. Raja Muhammad Razak Saab, he is the former Secretary, Government of Azad Jammu and Kashmir.
Bismillah ar-Rahman ar-Rahim. Ma'am, thank you very much. First of all, I would like to extend my gratitude to the Dawn Media Group for convening such an important session and event, and in particular for giving representation to Azad Jammu and Kashmir. So, the crux and discussion of the today's event, taking that forward, I would like to just highlight that the Azad Jammu and Kashmir, that is, we call it the state of Azad Jammu and Kashmir, that comprises 13,297 square kilometer, with population having around 4.563 million as per the latest census report. And the areas which I would like to highlight, that certainly we have some success stories, and at the same time we too have some challenges. If I discuss the success stories, the first, that recently, a week ago, we have been, the government of Jammu and Kashmir have been able to merge the population and health department under one minister and under one secretary. And this is the process which is going to improve the service delivery in Azad Jammu and Kashmir. And when I quote this success story, I must acknowledge and give the recognition to the UNFPA, because it was their efforts, those started in 2020, and finally the effort succeeded, and now just a week before that has been notified. Another important issue is, if we look at the policy side, that after overall, we can say that the general awareness, the government of Jammu and Kashmir has been able to draft draft of the law that is titled the Child Marriages Restraint Act. So that is almost, we are having the consensus on it, but that is at present pending before the Legislative Assembly. And before coming to this session, I checked from the Assembly, and what they informed, that hopefully that is likely to be tabled and passed in next session. So in that way, hopefully this would be another achievement. And third important thing that I would like to discuss over here is that, as our learned participant earlier said, rather learned speaker said, that unless we may give the central position to the women, and that can only be achieved through the better education, certainly the target set under the CCI recommendation and for the population development, that cannot be achieved. So in this perspective, I would like to add that in Azad Jammu and Kashmir, in every district there is a university. And now there are one or two districts, those are left over. The government has already announced, and we are looking forward that in a couple of months that bill shall be passed, and those districts shall also be having the universities. And we have one particular university for women, that is the Women University Bog, and likewise we have the 4 medical colleges. So I mean that these are the things which are adding support to the cause of family planning and reproductive health, because with the better education only we can succeed to get the targets. And this is the way that at this point in time, Azad Jammu and Kashmir is having the literacy rate 77.5, which is quite on higher side if we compare it with the national figure. Likewise, if we see towards the women literacy rate, that is 68.2. Okay. Now, finally, I simply discuss the challenge. In a 1 minute, I am going to conclude it. That the challenge, the Azad Kashmir government, and as my learner friend from the GB said, that is you can say the 18th amendment, With the 18th amendment, though the provinces, they are getting the more share, but the Azad Kashmir and the GB, they are not getting any, they are not being the part of the NFC ward, they are not getting any share. So I would request that Ministry of National Health Services and PPW, they should continue to support the regional governments, I mean the regional departments, that is the Population Welfare Department of AJK and GB. In this way, I hope that we can continue and we can have the more successes. Thank you very much.
Thank you, sir, very much. I'm sorry, Zara Saab, mere khayal mein we are overrunning our time. It's 5:30, and today's sessions were supposed to finish at 5 o'clock. So I'll turn to you, Naila, if you could kindly, Naila Saqib, Secretary, Health and Population Department, Government of Punjab.
Yes, but it works. Yeah. Thank you, Ms. Shahnaz Wazir Ali. Thank you, Dawn, and thank you, Dr. Seba, for inviting us here. I'll try. Doesn't work. Achha, can I? Am I audible, or should I try my natural? All right. Thank you, ma'am. It's very hard for me to try and encapsulate the journey that we have embarked on last year in 2024. I think it was there was very strong realization in the government that you cannot differentiate between population welfare, population control, and healthcare, particularly primary healthcare services. So towards the end of the 2024, we were successful in a quick merger of Population Welfare Department and Primary and Secondary Healthcare Department. I think this was long awaited and it was long due to, which was much appreciated. It was not meant to showcase an achievement. It was actually meant to integrate population control into the primary healthcare service and wherever the maternity services were being provided. So the merger alone would not have given us any results unless we started thinking about how to increase the coverage of primary healthcare service. For decades, primary and secondary healthcare services, the department had been trying to increase and reach the goal of universal healthcare care in union councils at the microscopic level. However, operationalizing our basic health units, which I understand could be available across the country, was not possible primarily because of the kind of I'll be talking about real problems: absenteeism, non-availability of healthcare professionals, disgruntled and sometimes completely disinterested healthcare professionals going to smaller districts with very low salaries. So it had to be a merger of healthcare and population welfare had to be complemented with some innovative solution for providing healthcare service in far-flung areas. So what we tried to do was outsourcing of the basic healthcare units to somebody, as we say, public-private partnership, but the model had to be designed so carefully that it yields some results. So what we did was we outsourced these hospitals, small clinics, not to the entities or to the corporate players. We outsourced these BHUs to doctors as entrepreneurs on a fee-for-service model. So the pay for performance guaranteed us payment against each service, which was monitored and recorded and verified in real time. So as of today, we have been successful in verifying both provision of safe birth and long-acting family planning. So family planning, short acting as well as long acting, was integrated and made a part of the essential package of healthcare services that were measured and were paid against. And that way, today, I think I can boast of it that we have been able to operationalize more than 2,500 basic health units and over 50 rural health centers. And the rural health center model is even more complicated and even more, I would say, prestigious, as it entails engagement of consultants in the system. So I think that was one achievement that we had, and we have measurable results. This is where we can share our data also. From 16,000 mothers getting family planning services postpartum, we reached the figure of over 80,000 in the year 2024 and 25. I would respond to the observation of the federal minister as well. Punjab has taken another rather giant and bold leap, trying to cover the hitherto uncovered areas. So lady health workers are covering over 47% of the area, and the rest of the area was still uncovered, which included some of the rural pockets as well as urban areas. So in another 20 days or so, we would be able to launch our first community health inspectors model, which would engage not the usual lady health workers who were good resource but could not provide midwifery services, basic antenatal and postnatal cover in the household. So with this model, we hope to reach every household through our midwifery services. These would be skilled birth attendants who can provide antenatal cover, postnatal cover, postnatal family planning services, immunization, and even geriatric services. So not only that, I hope that through digitization of each household, these community health workers, community health inspectors will be able to provide the data that informs the decision making in primary education, as well as trying to cater to the unemployment in each household or in each pocket. That's the gist of what we are doing. I wish I had a presentation where I could share complete data with you as well. Thank you very much.
Thank you very much, Ms. Naila Saqib. I know in every province there's a lot happening. Many initiatives और बहुत सारी ऐसे नए मॉडल्स आप डेवलप कर रहे हैं जिसके लिए शायद आज काफ़ी वक्त नहीं है सब कुछ डिस्कस करने के लिए, लेकिन दो तीन चीज़ें तो आपकी गुफ्तगू से बिल्कुल वाज़ेह हैं कि हर सूबे ने initiatives लिए हैं to focus on a model which is like a public-private partnership model, to be able to ensure that civil society and non-governmental management organizations are becoming partners to ensure good management of their health outlets and their health services and family planning services. It is in Sindh in particular, legislation has been undertaken. There have been, the large model in Sindh is the PPHI, the People's Public Health Initiative, where about 672 BHUs have been adopted by them, and also rural health centers and district headquarter hospitals, etc. So management models and public-private partnerships तकरीबन सारे सूबों में ये एक नया इनिशिएटिव है. आज की नशिस्त का मकसद ये था कि सारे सूबे अपने जो प्राइम हाई प्रोफाइल इनिशिएटिव्स हैं उनके बारे में बात करें और ये मॉडल्स एक दूसरे के साथ कुछ एक्सचेंज करें ताकि पता चले कि इस मॉडल में किस तरह ये मॉडल्स चल रहे हैं. Are the services better? Is it sustainable? Is it unit cost effective, etc.? And are we getting the final results of lowering the fertility rate and increasing modern, long-lasting contraceptive methods? So I wish we had had more time because the provinces are really the front line people to deliver programs. Policy is one thing, but implementation and delivery really lies at the provincial level. So thank you to each and every one of you. It's very special thanks to the Federal Minister for Health Regulation and Services, Dr. Malik Mukhtar Harat Sahab. We hope that you will lend a supporting role to the provinces, sir, because really the delivery lies at the provincial level. The decision making is at the provincial level, and that's really so critical that for all the provinces to meet and to share good models and experiences. I'd like to thank everybody. And thank the ministers who came online. Try to wrap it up quickly. Actually, we can have long discussion.
Can I get the